This clip is sponsored by American Mobile. If you're a nurse interested in traveling, visit americanmobile.com to get started.
It's really hard to be a bedside nurse and have a surgeon say there's nothing we can do.
Yeah.
Because as a nurse, you know what that means, and you
Yeah.
know what that means for the family. You know what that means for your patient.
Mm-hmm.
So, yeah, that can be a challenge for sure. But
Yeah. Do you feel like you have those conversations with patients, or do you feel like your teams are normally pretty good about having those with family?
oh boy, um, it really depends.
Yeah.
Our surgical team is really good about being quite frank,
Yeah.
especially if it's a trauma patient that comes in and we have access to their next of kin. You know, we tell
Mm-hmm.
them we'll do everything we can, but this is a very serious and grave injury. You know, this could be potentially fatal.
Yeah.
Um, I always find now that I've, that I'm an older nurse, I find that I am more, I'm sorry, I'm less likely to sugarcoat
Yeah.
things. I present it very nicely, and I always tell family, I've seen this before, um, and they'll ask, and you have family
Mm-hmm.
that will ask you, have you
Yeah.
seen this before? Do you think they're going to die? And you've got
Yeah.
to, I think there's a very fine line that we walk there with that
Mm-hmm.
question. You know, we don't have a crystal ball, but in other cases that I've seen here, this may not be survivable for your loved
Yeah.
one.
Yeah. I think in those conversations the most important thing is to just be very transparent about what you know for that particular circumstance,
Right.
but also know, I mean, as a nurse, if I know for sure, I mean, if they're on three pressors and their lactic is raising and they're like acidotic and I can't get their maps above 65, I'm comfortable talking to the family
Yeah.
about this is what I'm seeing and this is, but a lot of times I feel like our teams are pretty good about preparing families before it gets to that point. But in some, a lot of the gray area where, we're still doing interventions and like hoping that things will work. Uh, Families want to cling on to any,
Eh,
hope that they have. So you
totally.
you you don't want to take that away from them, but you also just want to prepare them
Yep.
for what is probably inevitable,
Yep.
you
Yep.
know.
The reality, I always say, it of course we want your loved one to get better, and we're doing everything we can, but I
Mm-hmm.
fear that despite everything that we're doing, that this it may not be enough.
Yeah.
And I
Yeah.
think we definitely, I don't know if this is true for you, but I feel that we do not, just in general, we don't talk about death enough. And I find that in a
Mm-hmm.
surgical ICU, I mean, medical ICU too, we see a lot of irreversible conditions.
Mm-hmm.
Um, and so we become comfortable saying, this patient is likely going to die. And so just coming with that experience, being able to talk to family and saying, we've kind of reached the point where we're not really sure what else we can do. And
Yeah.
again, I find that a lot in surgical and trauma settings.
Mm-hmm.
They have, for example, recently we had a very severe ortho trauma case come in and brought him to the operating room, and they got him open, and they were like, there is just the extent of his internal vascular injuries were so severe that there was
Mm.
just nothing that they could do. And so they closed him up and brought him to the ICU, and then he passed. And they, told the family, like, we tried, we took him to surgery and we did everything we could. And unfortunately, it was just not in the cards.
Yeah.
So
Yeah, I mean, there's a lot of times certainly for trauma, I can imagine, you don't know what you're getting into.